1 minute down. Hi, I'm Paige. I'm going to be your student nurse today. Can I have your name and date of birth?
Madison Clower, 8/13/04.
For privacy, I'm going to need PPE shortly, but I don't need it right now. I'm going to check your wristband. Do you have any allergies?
Nope.
I'm going to borrow your watch as well. Thanks. Do you have any allergies? So provider orders today, so they ordered a head to toe assessment. So I'm gonna take your vitals, ask you some questions, and then we're gonna go through all the body systems and do the assessments. Do you have any questions before we begin?
No.
Do you need anything before we begin? Go to the bathroom, you need any glass? You have wear glasses?
I got contacts in.
Perfect, you're good to go. Do you know where you're at?
Yep, Southwest Tech
Why you're here?
for class,
What day it is?
April 6th,
And your name?
Madison.
Perfect. I'm gonna have you stand up for me. We're gonna be looking at your posture for kyphosis, lordosis, and scoliosis. And you can sit back down for me. And then your general appearance, so your expression is good, neutral, your mood, you seem happy, very pleasant, your speech I can understand, and your general hygiene is great. So my 3 questions, have you ever broken any bones?
Yes, I was born with a broken collarbone.
All right. Have you ever had any surgeries?
No.
And do you currently take any medications?
No.
And are you in any pain today?
No.
Okay. All right, and then I'm gonna have you repeat these 3 words after me. So blue sock bed.
Blue sock bed.
And we're doing short, immediate, and long-term memory. So yes, blue sock bed.
Blue sock bed.
And who is your first grade teacher?
Mrs. Vesperman.
All right, and then what did you have for breakfast?
Nothing.
And what were those 3 words?
Blue sock bed.
All right, perfect. And then I am going to start with vitals. So can you scoot up on the bed for me, please? Thank you. Okay, open your mouth and put it under your tongue. Oral temp of 97.7. And then your blood pressure. Yes, good. Thank you. You can rest your arm on there for me. (112/72). So in the scale, that would be the low pressure scale, that would be normal. Normal is, write it down here. I can't do that, can I? Normal is 120, below 120 and below 80. Elevated is 120 to 129 and below 80. Stage 1 hypertension is 130 to 139 and 80 to 89. Stage 2 is 140 and above and 90 and above, and then hypertensive crisis is 180 and above and then 120 and above. And then I'm gonna have you rest your hand up here again, and we're gonna take your radial pulse. Was 78, and then we're gonna do respirations. So if you could just breathe normally for me. And that was 14. The rhythm of the pulse was equal and regular, and yes. I think I'm just gonna go ahead. So then skin, I'm looking at the skin for lesions, bruising, rashes, and color. And then I am going to palpate the skin for texture, turgor, and temperature. And then I'm looking at the nails on the hands and the feet for some color, contour, and shape, color, and contour on the hands and the feet. And then for looking at the skin, I would verbalize A, B, C, D, E, which is asymmetry, border, color, diameter, and evolving. And then and I think that's it for skin. So moving on to neuro, I'm looking at the head for size, shape, symmetry, and color. And I'm palpating for tenderness and masses. And then I'm looking at the face for symmetry and expression. So I'm gonna have you smile for me, and symmetry looks good. And then I would palpate for tenderness and deformities. And then I'm looking at the eyes, the pupils and the irises for shape, symmetry, and color. I'm looking at the conjunctiva, so I'm going to have you pull your eyelids down for me. For color and moisture, I'm looking at the sclera for lesions in moisture, which they look good. I'm going to have you close your eyes and I'm going to look at your eyelids for lid lag, edema, lesions, and color. And then I'm gonna just put your bed up a little bit so we do these next ones. And then, so, looking at, oh, I forgot this one. So, I'm gonna have you say when you feel this. So.
Yep. 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 Yep.
Okay. All right, and I'm gonna flip the lights on. And we're doing pupillary reactions. I'm gonna have you look straight ahead at me. And then we're doing a combination, so I'm gonna have you follow this pen. And then extraocular movements, I'm gonna have you follow my finger. Perfect, and then I'm gonna have you read this for me for near sight.
Head to toe assessment.
Thank you. All right. And then I'm gonna palpate the external eyes and globes for tenderness. Do you have any tenderness or pain with that?
No.
And then I'm going to the ears. So I'm looking at both. I'm gonna pull your hair back. Thank you. So I'm looking at the ears for size, shape, symmetry, color, cerumen, skin characteristics, foreign bodies, discharge, and lesions on both ears. And that's the external ears. And then I'm gonna palpate, fold the pinna forward, palpate the tragus, and then the mastoid process for tenderness. And then we're going to look inside the ear at the middle ear. And we're looking for redness and swelling and foreign bodies and cerumen. Up and back for adults, down and back for children. And then we're looking at the tympanic membrane. It can be flat, bulged, or retracted. Hers is flat and pearly white, which is healthy. It looks great. And I'm gonna do the whisper test. So just repeat what you hear after me.
ABC. 1, 2, 3.
Okay, we're gonna move on to the nose. So I'm looking at the external nose for size, shape, symmetry, color, discharge. I'm going to palpate for deformities and tenderness, and then I'm going to also palpate the maxillary and frontal sinuses for tenderness. Do you have any tenderness there?
No.
All right. And then we're going to look in the nasal cavity, so I'm gonna have you look up for me. And I'm looking for deviation, color, polyps, and lesions. Deviation, color, polyps, discharge, drainage, color, deviation, polyps, and drainage for the nasal cavity. And I palpate it, and then I'm gonna have you close your eyes and plug one nostril, and then what do you smell?
Vanilla?
And Another one.
Vanilla.
Yep, good job. And then we're going to move on to the mouth. So starting with the lips, we're looking at color, moisture, cracking, and lesions, which hers look great. And then looking at the buccal mucosa, when you open your mouth, we're looking at color and moisture. Then we'll look at the gums for retractions, bleeding, edema, and color. Your gums look great. Your tongue, we're looking at position, color, and moisture. I'm gonna have you say light, tight, dynamite.
Light, tight, dynamite.
And I'm gonna look at your tongue. And then hard and soft palate, making sure they're intact. If we were palpating that, it would be glove pinky for a neonate and a glove finger for adult. Tonsils, we're looking at exudate and size. And for tonsils, we're looking at mobility. I'm going to gums, tongue. And then for gag reflex, if we were doing that today, I would take the tongue depressor and place it farther back in the mouth to do gag reflex. And I will have you open and say ah. Perfect. So uvula mobility was good. Tonsils were good size, no exudate. All right, moving on to the neck. So I'm looking at symmetry and range of motion. So symmetry, it looks great, symmetrical. I'm gonna have you move your neck all the way around, perfect. And then I'm gonna have you, let's do your lymph nodes first. I'm gonna palpate your lymph nodes. So pre-auricular, posterior auricular, occipital, posterior cervical, supraclavicular, superficial anterior cervical, and then deep cervical. Maybe look to your right and to your left, and then tonsillar, submandibular, and submental. I did that. And then I'm going to have you lay back on the bed. I'm gonna put this up just a little bit. Set this down here. And I'm gonna have you look to your right. And we're looking at jugular vein distension, and to your left. No jugular vein distension. And then I'm gonna palpate the carotid one at a time. And then I'm going to listen with my bell for bruise. Let me hold your breath. And then again. Perfect. You can breathe. Perfect. All right, so I'm going to have you sit up again. I'm gonna have you stand up with me. Do you want your shoes?
No, sorry.
Good? Okay. So I'm looking at your anterior posterior lateral ratio. So it is 1 to 2. And then I'm gonna turn around. We're gonna do your posterior tactile fremitus. So maybe say 99.
99, 99, 99, 99.
And then we're gonna do chest extrusion at the 10th rib. So I'm gonna have you breathe in. And breathe out. Good. And you can go have a seat again. Okay. And then now we're going to listen to your lung sounds. So I'm having you take a deep breath when I move spots, and you can take your time, okay? So 10 on the front. So the three sounds on the sides are bronchio, vestibular, and vestibular.
Yeah.
For me. Okay, so then we're gonna listen to the lateral sounds. And look at your arm produce a little bit. I'm gonna go to the posterior. And then I'm going to inspect. I'm looking at your like breathing or inspecting for effort, use of accessory muscles, retractions, and rhythm. And I think that's good. So you can lie back for cardiac, and I'm gonna have you get on your down, thank you. So I'm looking at the precordium for wounds, scars, and deformities. And I am going to palpate for lifts, heaves, pulsations, and tenderness. Do you have any tenderness?
No.
And I'm going to listen. So I'm going to say my points before I do it. So it is aortic, pulmonic, Erb's point, tricuspid, mitral. And then at the mitral, we'll listen to the apical for 1 minute. 1 full minute, I'm sorry. I did my rest of my 30 seconds. A 68, rate and rhythm were normal and regular. Well, rate was 68 and rhythm was normal and regular. Just some palpate things. So now I'm gonna palpate the pulses. Typically I would have her pull up her pants and listen to or feel the palpatio, but I'll just have her, I'll switch through them. So we're gonna do temporal. We already did carotid one at a time. Brachial. Radial. We would do femoral, popliteal. Let me put your knees up just a little bit for me. Perfect. Posterior tibial. And then dorsalis pedis. All right, perfect. And then I'm gonna have you sit up for me, and I am going to, I guess I could have done it when you were sitting down, but that's okay. So do you feel sensation in all your extremities while I'm doing this?
Mm-hmm.
And movement's good. I'm gonna look at capillary fill of your hands and your feet. Good. And then edema. So her edema is a 1+. So 1+ is 2 millimeters rapid rebound. 2+ is 4 millimeters, 10 to 15 seconds. 3+, 6 millimeters, 1 to 2 minutes, and 4+, 8 millimeters, 2 to 3 minute rebound, or 2 to 3 minutes. Expected. I think we're good for cardio. And then, sorry, I'm gonna have you lay down one more time. I'm gonna put this under your knees, make sure you're comfortable. Is that good?
Mm-hmm.
All right, I'm gonna have you lift this up for me. I'm gonna look at your abdomen. Gorgeous. Thank you. And then, so I am going to inspect for color, contour, size, symmetry, not size, okay, pause. Color, contour, striae, scars, symmetry, hair distribution, lesions, movement, hair distribution, movement, scars, striae, symmetry, color, contour, hair distribution, movement, lesions. That's all I got today. And then I am going to listen before I palpate, starting in the right lower quadrant, listening for vowel sounds. And I'm listening until I hear some. And then I am going to use my bell to listen for Burley's and vascular sounds at the aortic, renal, and iliac. I'm going to palpate. I'm palpating for muscle resistance, tenderness, bladder distension, and surface characteristics. In the lower right quadrant. Any tenderness or pain with this at all?
No.
Perfect. Alright. I am going to have you sit up for me. And we're actually going to stand up, and I'm going to have you do 2 tests with me. So the first one,
Sorry.
nope, you're okay. Take your time. Okay. So the first one, we're going to heel to toe. We're going to do 5 steps forward and 5 steps back. Perfect. And then we're going to close our eyes. And we're gonna put your arms out and touch your fingertip to your nose. Perfect. All right, and then we're going to start with the muscles. So we're gonna start with the sternocleidomastoid, and we're going to look left and right. And then I'm gonna have you look to your left and to your right. And then the trapezius, we're going to shoulder shrug, and then I'm gonna feel you do it as well. Perfect. And then deltoids, we're going to go like this, go up and back down. Again, good. And then we're gonna do biceps and triceps. So biceps in, triceps out. And then grip strength, so I'm gonna have you open and close your hands. Perfect, and then do that again, good. And then over the bed for a little bit here. We're gonna do hips. So we're going to abduct and adduct, abduct and adduct. And I will do them at the same time. Abduct, adduct, abduct, adduct. Good, and I'll have you take a seat. And we are going to go out with our legs, and that is quads, and then go back in, hamstrings, perfect. So out, back in, good. And hips, spine's not in this one. Biceps, triceps, hips, quads. Okay, so I'm going to say her muscles were equal, or symmetric, appropriate size, and a 5 on the muscle strength scale. The scale is 5 is normal, 4 is slight weakness, 3 is weak, 2 is poor range of motion, 1 is severe weakness, and 0 is paralysis. And then we're gonna do range of motion. So with the temporomandibular joint, we're going to open and shut. So open is extension and close is flexion. Good, and then I'm gonna feel it, open, close, some slight popping in the jaw. And then for the neck, we're going to flex, extension, side to side, and rotation. Good, and then I'll feel you do the same things.
Sorry, I cannot rotate my neck.
Extend side to side, and then you don't have to do the rotation. And then shoulders. So you can stand up for this one, you need a little bit more room. So we're going to flex, extend, abduct, adduct, internal rotation, external rotation. And I'll feel you do those. Good. And then with the elbows, we're going to flex, extend, supinate, pronation, supination. Flex, extend, pronation, supination, good. And then wrists, we're going to flex, extend, rotation. And flex, extend, rotation. And with hands, we're just going to extend our fingers, abduct and adduct. Extend, abduct, adduct, good. For spine, we're going to flex, extend, and rotate. And then I'll feel you do that. Flex, extend, rotate. Good. Shoulders, elbows, wrists, hands, then hips. We're going to flex, extend, abduct, adduct, rotate, and then the other one, flex, extend, abduct, adduct, rotate. And feel free to grab onto something if you'd like. All right, let's do this one first. So flex, extend, abduct, adduct, rotate, and the same thing on the other side. Good. And then for the knees, I'll have you take a seat, and we're going to extend and flex. And I'll have you do the same on the other side. Good. And then you can do one at a time if you'd like, it's up to you. Good. And then for ankles, we're going to plantar flexion, dorsiflexion, inversion, eversion. So plantar flexion, dorsiflexion, inversion, eversion. Okay, so we did ankles, knees, hips, spine. Okay, I did memory already. Is there anything you need before I go?
No.
Alright, so my bed is locked and lowered. The bed rails are secure. I am going to, so I didn't say I would gather and cleanse my equipment, so we're gonna say that I would have done that. And I am going to cleanse it now before I leave. I'm gonna pick up all my supplies, and my patient doesn't need anything. The bedside table will be within reach, the call light will be within reach. The bed lock lowered. Room is fall risk free. I will document any abnormalities according to agency policy. Are you comfortable in that position? Okay. And I'm going to hand sanitize, and I think that's it.